now have the WCCPCI 2014 Tara Devi Memorial Oration, and the keynote address will follow next. I would like to invite um, Dr. A.K. Sinha from Patna, along with is Mrs. Lisa Tatum Levy. They'll be chairing the proceedings of this oration. And this year, this oration is being conferred on Dr. Rick Levy, Senior Consultant Clinical Clinical Psychologist, who has been as one of the in mind-body medicine. I would like to request Dr. Girish Patel, Usha Kiran, Ray Bhatt, and J.J. Patel to also kindly join Mrs. Levy and Dr. A.K. Sinha. May I request Dr. Rick Levy to kindly deliver the oration, and this afternoon he is going to deliberate on how to use your mind to heal your heart, a patient self-help kit. Dr. Levy.
I'm sorry, I have to be over here because if I'm near the computer, it usually will not work. So please tolerate my IT problems. I want to thank Dr. Chopra, the entire committee, and the Brahma Kumaris for this wonderful event. Now, depressive disorders and subclinical symptoms like hopelessness correlate with an almost 3 times higher risk of developing CAD. Risk for onset of CAD is 4 to 5 times higher for those with severe depressive symptomology, women, and patients facing ongoing psychosocial stressors. There are more than 60 longitudinal studies and over 100 data and literature reviews supporting these facts. Depression and subclinical depression. The American Medical Association showed that the SSRI antidepressants are no better than placebo. It's just the fact. And in fact, there was more than 2-to-1 range in clinical effect from the SSRIs based solely on the strength of the doctor-patient relationship. Strong relationship, much better effect. Weak relationship, almost no effect. All of it, however, placebo. Basically safe to prescribe, not for everyone. Psychologists and psychiatrists still generally recommend their usage, but that's because we have nothing better to use, and we figure that placebo's effect is better than nothing. Mild cardiotoxic effects, increased heart rate, reduced heart rate variability, and specific contraindication for warfarin, and the usual side effects. So one really can't use the SSRIs too well here. Psychotherapy, proven very clearly, 2 major meta-analysis studies by Greenberg that show that it works quite well for depression and anxiety. But the problem with the psychotherapy is it can take too long. It was particularly the long-term psychotherapy that helped the most. It can be too costly, and it requires properly trained doctoral level clinicians for effectiveness. You do not have the doctoral level psychologists here to do the job. Meditation, it's proven effective for mild to moderate depression, anxiety, but not as powerful as psychotherapy. Patients quit its practice before they receive the clinical benefit because of distracting runaway thinking. And also, it does not work for generalized anxiety disorder. Clinical hypnosis works for both depression and anxiety, but it requires properly trained doctoral level clinicians for effectiveness, and it's stigmatized by Patient Association of Clinical Hypnosis with stage hypnosis, which of course is not good for you. So here is where mind-body medicine comes in, since it directly targets stress, which expresses itself as depression and anxiety. There are 5 pillars to mind-body medicine. When we combine them, they are very effective. It reverses atherosclerosis, as Dr. Gupta's work has shown. It activates and sustains parasympathetic tone, the relaxation response, reduces inflammation, improves circulation, and increases immune function. The 5 pillars are healthy heart diet and nutraceuticals like CoQ10, omega-3s, B-complex plus, regular exercise, sufficient sleep, special programs for obesity and smoking, and proven stress reduction techniques. But the powerful ones, psychotherapy, meditation, and clinical hypnosis. We have good screeners to identify depressed and anxious patients in cardiac settings, but then what do we do with them? We know what works, but it's too time-consuming, too expensive, and there is a lack of properly trained doctors in psychology to deliver the services. To take care of this problem, I have developed a patient self-help kit. This is a 55-page manual and 4 recordings using extreme distressors of the mind that I have developed over 40 years of clinical practice and research. These are highly effective, combining the best is in your hands. Thank you.